Welcome to the deep dive. Today, we're tackling a really common health issue in our older feline friends, hyperthyroidism.
Mm,
Basically, it's when their body's metabolism goes into overdrive because there are just too many thyroid hormones floating around.
that's right. And, while you might occasionally hear about it in dogs, it's overwhelmingly a cat thing.
Really? So mostly cats?
Mostly cats. When we do see it in dogs, the cause is usually quite different, often thyroid cancer, or sometimes accidentally giving too much thyroid medication.
Okay,
So yeah, for this deep dive, we're really focusing on what this means for cats.
got it. So let's get right into it then. Our aim here is to give you a really clear picture of what's going on with feline hyperthyroidism.
Hmm.
We'll look at what causes it, how you might spot the signs, which parts of the body are actually affected by this high-speed metabolism,
Right.
and crucially, what can actually be done about it. So think of this as your kind of quick guide to understanding this very common condition.
Exactly. We're going to dig into the key things you need to know, whether you have a cat yourself or you're just, interested in keeping up with animal health.
Perfect. So let's start with the big question, the why. What actually causes hyperthyroidism in cats? What gets the whole process started?
Okay. So in the vast majority of cats, we're talking 98, maybe 99%, the cause is benign nodules.
Benign, so not cancerous.
Usually not, no.
Oh.
They're called autonomously hyperfunctioning nodules on the thyroid gland. Bit of a mouthful, I know.
Yeah. What does that actually mean?
Well, think of the thyroid gland in the neck as this tiny hormone factory, right?
Okay.
These nodules are like little parts of the factory that have just gone rogue. They start churning out way too much thyroid hormone, T4 and T3 specific.
And they just ignore the body's signal.
Completely ignore them. They bypass the normal control system that usually tells the thyroid, okay, that's enough hormone.
Wow.
And this can happen in just one side, one lobe of the thyroid, or sometimes in both.
So, tiny rogue hormone factories. You mentioned, though, that a very small percentage have a different cause.
That's right. In maybe 1 to 2% of hyperthyroid cats, the underlying problem is actually thyroid carcinoma.
So, cancer.
Yes, a cancerous growth on the thyroid that also overproduces hormones. It's just much, much rarer in cats than the benign nodules.
And in dogs.
In dogs, as we mentioned, hyperthyroidism itself is uncommon. But when it does happen, thyroid cancer is a more likely cause than in cats. That or the accidental overdose situation.
Right, okay. So, back to the cats and these nodules. Are there things that might make a cat more likely to develop them? Risk factors?
That's still an area of active research, actually. There have
Yeah.
been some studies hinting at a possible link with, say, canned food diets.
Oh, interesting.
Yeah, and there's also been some talk about endocrine disruptor toxins, things like PBDEs,
EBD.
polybrominated diphenyl ethers. They used to be in flame retardants, in
Yeah.
furniture electronics.
Uh,
But the link between those chemicals and feline hyperthyroidism isn't really proven yet. It's still speculative.
so nothing definite there.
Not yet. What is clear is that the risk definitely increases with age. It's primarily a disease of older cats.
Okay, age is a big factor.
Yes. And interestingly, there's maybe some evidence suggesting purebred cats might have a slightly lower risk compared to, domestic shorthairs or mixed breeds.
Huh. That is interesting. Okay, so let's shift to the how does this actually show up? What are the signs owners might notice that make them think, maybe something's up with the thyroid?
Well, hyperthyroidism is really a multisystemic disease. Those hormones affect almost every part of the body. So the signs reflect that increased metabolism.
Like what specifically?
One of the absolute classic signs is weight loss. Sometimes pretty significant weight loss.
Okay.
And this is the key part. It happens even though the cat seems ravenous. They're eating constantly. We call that polyphagia.
Eating a lot but losing weight, that's a big red flag.
Absolutely. You might also see more vomiting, maybe diarrhea. They often drink a lot more water.
Increased thirst?
Yeah, polydipsia. And because they're drinking more, they're urinating more, polyuria.
Okay, drinking, peeing, eating.
Right. Also, rapid breathing to chipney and just generally being more active, maybe restless, sometimes even hyperactive.
Hyperactive, wow.
Yeah, some cats can even become more irritable or sometimes even aggressive, which is a big change of personality for them.
That would be worrying.
Definitely. And in more advanced cases, you might even see them struggling to breathe, which is dyspnea.
Okay, those are pretty clear signs an owner might pick up on. What about when they get to the vet? What might a vet find during an exam?
During the physical exam, yeah, there are often clues. One really common finding is an enlarged thyroid gland.
You can feel that.
Often, yes. The vet might feel a little lump or swelling in the neck area, we call it a thyroid slip. And in about 70% of cases, both sides, both lobes are enlarged.
Both sides, okay.
And despite that increased appetite we talked about, these cats often look thin. They have poor body condition, maybe noticeable muscle loss.
So skinny despite eating well.
Exactly. Listening to the heart is also really important. It's common to hear a heart murmur
Murm.
or just a really fast heart rate tachycardia. Sometimes even an abnormal extra heart sound called a gallop rhythm.
A gallop, like a horse.
Sort of, yeah. It's an extra sound that shouldn't be there. Their coat might also look a bit rough, unkempt. And their nails.
What about the nails?
They can sometimes seem to grow really quickly and get quite thick and brittle.
Thick nails, okay. Now, earlier you mentioned a different, less common way this can present, the apathetic form.
Ah, yes. That's really important to remember. It's called the apathetic presentation. It happens in less than 10% of cases.
So not the typical hypercat.
Exactly the opposite, actually.
Okay.
Instead of being hyper and hungry, these cats might have a poor appetite or even stop eating entirely, anorexia. Yeah. They might seem depressed, lethargic, weak. It's almost the mirror image of the classic signs.
Wow, that could definitely make it harder to suspect hyperthyroidism initially.
It really can. So vets always have to keep that possibility in mind, even if the cat isn't showing those typical hyperactive signs.
Good point. So we've got the why and the what. Let's move to the where. Which specific body systems take the biggest hit from all these extra thyroid hormones?
Right. Well, as we've sort of touched on, it's pretty wide-ranging. Behaviorally, besides the hyperactivity or irritability, some cats just become more vocal, maybe seem more anxious or restless.
Okay. And the heart. You mentioned murmurs and fast rates?
Yes, the cardiovascular system is a major target. The heart is constantly working overtime. This can lead to the heart muscle actually thickening and enlarging. That's myocardial hypertrophy.
Thickened heart muscle. Sounds serious.
It can be. And high blood pressure hypertension is also really common with hyperthyroidism.
Blood pressure too. Okay. What about their digestion? You mentioned vomiting and diarrhea.
Yeah, the gastrointestinal system definitely feels it. You can get what's sometimes called chronic cellular malnutrition,
Meaning?
meaning even though they're eating a ton, their body's burning energy so fast, and the food might be moving through their gut quicker.
Ah, faster transit time.
Right. So they might not absorb nutrients properly,
Yeah.
malabsorption. And sometimes all this metabolic stress can even lead to secondary liver issues or damage.
Liver problems too. Okay. And muscle wasting.
Yes, musculoskeletal effects include that muscle wasting, what we call cachexia. It contributes to them looking thin and frail.
Makes sense. Any other systems? Nervous system.
There can be nervous system effects too, though perhaps less consistently obvious than, say, the heart or weight changes.
Yeah.
Things like tremors or nervousness can sometimes be seen.
And then there are the kidneys. You mentioned this is a really crucial area.
It absolutely is. The kidneys, the renal system are significantly involved, and it's a bit complex.
How so?
Hyperthyroidism often increases the rate at which the kidneys filter blood. That's the glomerular filtration rate, or GFR.
Okay, so they filter faster. Is that good?
Well, it seems like the kidneys are working better, but it's often masking underlying pre-existing chronic kidney disease, which is also very common in older cats.
Ah, I see. So the hyperthyroidism is kind of artificially boosting the numbers?
Exactly. It's like it's papering over the cracks. And worse, that constant high filtration rate might actually damage the kidneys further over time, something called hyperfiltration injury.
Wow. Okay.
Plus, these cats often lose the ability to concentrate their urine properly, which is another sign of kidney stress.
So the really critical thing is, what happens when you treat the thyroid?
Precisely. When we treat the hyperthyroidism, that artificial GFR boost disappears, and suddenly, any underlying kidney disease can become much more apparent. The kidney values might worsen significantly.
That's a huge consideration for treatment then. Really important for owners to understand.
Absolutely crucial.
Okay, so that leads us nicely into diagnosis. How do vets actually confirm it is hyperthyroidism, the how do we know part?
Well, yeah, because as you said, symptoms like weight loss, vomiting, drinking more, they can overlap with other common issues in older cats, right?
Like kidney disease itself, or diabetes, or even some cancers.
Exactly. Things like chronic kidney disease, liver disease, inflammatory bowel disease, certain cancers like intestinal lymphoma. So you really need specific tests to nail the diagnosis.
Makes sense. So what are the go-to tests?
The main diagnostic test, the cornerstone, is measuring the total T4 level in the blood. Serum total T4 concentration, or TT4.
Total T4.
Yes, it measures the main thyroid hormone, T4. If that level is consistently high in a cat with suggestive signs, that's usually enough to confirm hyperthyroidism.
Okay. What about T3? You mentioned that earlier.
T3 is another thyroid hormone, but measuring total T3 isn't nearly as reliable for diagnosis in cats. We stick with T4.
Got it. T4 is key. What if the T4 is borderline or the signs are maybe a bit vague?
Good question. In milder cases, or maybe very early on, the total T4 might still be in the upper end of the normal range or fluctuate. In those situations, measuring free T4 can be helpful.
Free T4.
Yeah, specifically free T4 measured by a method called equilibrium dialysis, or FT4 by ED. Free T4 is the tiny fraction of hormone that's not bound to proteins and is actually active. It might reflect thyroid production more accurately in some cases.
But there's a catch.
There is. The tricky part is that other illnesses, non-thyroidal illnesses, can sometimes falsely increase the free T4 level.
Oh.
So you wouldn't want to rely only on free T4 for screening or diagnosis. It's usually used alongside total T4 or when things are unclear.
Okay. Are there other more specialized tests?
Yes, for those really tricky mild cases, there are things like the T3 suppression test or the TRH stimulation test. They involve giving hormones and seeing how the cat's thyroid responds, but they're less commonly needed.
Right. What about imaging? Does seeing the thyroid gland help?
Imaging can definitely add valuable information. Chest x-rays, thoracic radiographs are important,
Why chest x-rays?
mainly to look at heart size and shape, see if there's evidence of heart enlargement or even heart failure caused by the hyperthyroidism.
Ah, checking for those cardiovascular effects.
Exactly. And an echocardiogram, which is an ultrasound of the heart, gives even more detail about heart muscle thickness and function.
Okay. Any other imaging?
Well, in dogs, if we suspect thyroid cancer, chest x-rays are also vital to check for spread to the lungs, metastasis.
Right.
In cats, an abdominal ultrasound might be done, perhaps less for the thyroid itself, but more to check for other concurrent problems, especially looking closely at the kidneys.
Assessing those kidneys again?
Yes. And then there's a more specialized technique called thyroid scintigraphy.
Scintigraphy. Sounds fancy.
It is a bit more involved. It uses a small, safe dose of a radioactive substance, usually a form of iodine or technetium, that the thyroid tissue absorbs.
Okay.
A special camera then creates an image showing where the radioactive substance has concentrated. It highlights the active thyroid tissue.
So you can see the overactive parts.
Exactly. You can confirm the diagnosis, see if one or both glands are affected, and even find rare cases where there's active thyroid tissue in an unusual place, like down in the chest.
Ectopic thyroid tissue.
Right. Scintigraphy is particularly useful for confirming the diagnosis in tricky cases and for planning treatments like radioiodine therapy or surgery.
And you mentioned routine blood work and urine tests are also important pieces of the puzzle.
Absolutely essential. Because of that kidney connection we keep talking about,
Right.
we need to carefully evaluate the standard blood tests, the complete blood count, and the biochemistry panel, looking closely at kidney values like BUN and creatinine, liver enzymes, electrolytes, and a urinalysis is crucial too.
What are you looking for in the urine?
Checking the urine concentration, looking for protein, signs of infection, things that might point towards underlying kidney issues even before treatment starts.
And you can measure kidney function more directly.
Yes, if there's a strong suspicion of kidney disease, measuring the actual GFR could give a much clearer picture than just the standard blood values, especially before treatment unmasks potential problems.
And you mentioned earlier, just because the urine is concentrated before treatment doesn't mean the kidneys are fine.
Exactly, that's a critical point. Concentrated urine before treatment does not rule out the possibility of kidney function declining significantly after the hyperthyroidism is controlled.
Okay. Anything else diagnostically?
Measuring blood pressure is vital. Indirect blood pressure measurement is a standard part of the workup and ongoing monitoring, since hypertension is such a common complication.
Right. Okay. So lots of pieces to put together for a full picture. Now, the big one. What can be done? What are the treatment options once a cat is diagnosed?
Okay, so for cats, we generally have three main approaches to treatment.
Three main ways.
Yes. First, there are antithyroid drugs. Second is radioiodine therapy. And third is surgical thyroidectomy.
Let's start with the drugs.
Okay. The most common antithyroid drug is methimazole. It's usually the first thing vets try, especially for managing the condition at home outpatient.
How does it work?
It works by basically blocking the thyroid gland's ability to actually produce the thyroid hormones. It interferes with the process.
And how is it given?
It comes as a small pill, usually given once or twice a day. There's also a transdermal version.
Transdermal, like a cream.
Yeah, it's a gel that gets absorbed through the skin, typically applied to the inside flap of the ear.
Is that as good as the pills?
It can be effective for some cats, especially those difficult to pill, but generally it tends to be maybe a bit less consistent in controlling the hormone levels, and it might take longer to see the full effect compared to the oral pills.
Okay, so pills or gel. That's option one. What's option two? Radioiodine.
Yes, radioiodine therapy. Many consider this the gold standard, generally the safest and often the most effective cure long-term.
A cure. How does that work?
It involves giving the cat a single dose, usually an injection, sometimes orally, of radioactive iodine, I-131.
Radioactive. Is that safe?
It's administered very carefully. The key is that the overactive thyroid tissue selectively grabs almost all of this radioactive iodine. The radiation then destroys those abnormal, overproducing cells.
That leaves normal tissue alone.
Mostly, yes. It has minimal effect on other body tissues, including any remaining normal thyroid tissue or the nearby parathyroid glands.
But it requires a special facility.
It does, because the cat is temporarily radioactive. They need to stay in a licensed facility, usually for a few days to maybe a week or so, until the radiation level drops to a safe point.
Okay, so effective, potentially curative, but requires hospitalization. And the third option, surgery.
Surgical thyroidectomy, yes. This means surgically removing the affected thyroid gland or glands.
Just take out the rogue factories?
Pretty much. It's also a potentially curative option. Like radioiodine, it requires the cat to be hospitalized for the procedure itself and for monitoring afterwards.
Okay. And briefly, you mentioned treatment for dogs is different.
Right. Just to recap that, since hyperthyroidism in dogs is rare and usually caused by cancer, treatment is often palliative, focused on managing symptoms and maybe slowing cancer progression, often involving surgery or sometimes radioiodine. But the goal isn't usually a long-term cure like in most cats.
Got it. Now, are there other things used alongside these main treatments for cats? You mentioned beta blockers.
Yes, beta blockers like atenolol are often used, especially initially. They don't fix the thyroid problem itself, but they help control some of the effects of the excess thyroid hormones.
Like the fast heart rate.
Exactly. They help manage the tachycardia, can help lower blood pressure, and might even reduce some of the neurological signs like anxiety or tremors.
So like a bridge to other treatments.
Often, yes. They can help stabilize a cat, make them a safer candidate for anesthesia if they're having surgery, or just manage signs while waiting for radioiodine or while adjusting methimazole doses. Sometimes they're used long-term alongside methimazole too.
Okay. And what about diet? Does food play a role?
It can. For cats with untreated hyperthyroidism, because their metabolism is so high and nutrient absorption might be poor, a highly digestible diet, often with a higher protein content, can be beneficial just to help them maintain condition.
Makes sense. What about that special diet you mentioned?
Ah, yes. There's a prescription diet, Hill's Prescription Diet Yard. It's specifically designed to be severely restricted in iodine.
Iodine. That's what the thyroid uses to make hormones, right?
Exactly. So the idea is, if you strictly limit the iodine intake, the thyroid gland just doesn't have the raw materials it needs to overproduce hormones.
Does it work?
It can be effective in controlling the hyperthyroidism for many cats if they eat it exclusively. No other food, treats, nothing.
That sounds strict.
It is. And while it's an option, especially for cats where other treatment aren't suitable for some reason, we don't have a lot of really long-term studies yet looking at the overall health outcomes and longevity compared to, say, radioiodine or methimazole. So it's another tool, but with some caveats.
Okay. It really sounds like there's a lot for an owner to discuss with their vet to pick the best path.
Absolutely. Client education is just paramount. Owners need to understand the pros and cons of each option.
Like side effects.
Yes. Potential side effects with methimazole, things like vomiting, loss of appetite, sometimes more serious blood cell changes or liver issues, although those are less common.
And risks with surgery.
Risks with surgery include potential damage to the nearby parathyroid glands, which control calcium.
Leading to low calcium.
Yes, hypocalcemia, which can be serious. Also, potential nerve damage causing laryngeal paralysis, affecting breathing, and of course the risks of anesthesia itself. And with any treatment, there's always the possibility the hyperthyroidism could recur later.
Right. Lots to consider, which takes us to what to watch for, monitoring and potential complications.
Yes, monitoring is crucial, particularly with methimazole treatment.
How often?
Typically, when starting methimazole, vets recommend rechecking blood work, including T4 levels, but also a complete blood count and a biochemistry panel to check liver and kidney values quite frequently at first, maybe every 2 to 3 weeks for the first 3 months or so.
Why so often?
To make sure the dose is right, getting the T4 into the target range without going too low, and to watch closely for any of those potential side effects we just talked about. Once stable, monitoring can usually be less frequent.
Okay. What about after surgery? What's monitored then?
Post-surgery, the immediate focus is watching for signs of low calcium, that hypocalcemia, which usually shows up in the first few days if it's going to happen. Also watching for any breathing difficulties from potential laryngeal nerve issues.
And T4 levels.
Yes, T4 levels are checked shortly after surgery to confirm the hyperthyroidism is resolved, and then usually periodically, say every 3 to 6 months, long-term, just to make sure it doesn't come back.
And after radioiodine?
After radioiodine, T4 levels are typically checked a few weeks or a month after treatment, and then again periodically, maybe every 3 to 6 months, similar to post-surgery. The goal is to ensure the T4 is in the normal or slightly low normal range.
And with all treatments, keeping an eye on the kidneys.
Always. Because treating the hyperthyroidism can unmask or worsen underlying kidney disease. Monitoring kidney function blood tests, urine tests, blood pressure is a key part of long-term management after any treatment. Usually about a month after starting treatment or after a procedure, and then regularly thereafter.
Okay. Now, what about the risks if hyperthyroidism isn't treated? What are the complications of the disease itself?
Untreated hyperthyroidism can lead to some really serious problems over time. We mentioned the heart issues. They can progress to congestive heart failure.
Heart failure?
Yes. The chronic diarrhea can become severe and debilitating. The high blood pressure can cause damage to organs like the eyes, potentially leading to retinal detachment and sudden blindness.
Blindness, wow.
Yes, it can also worsen kidney damage over time. And ultimately, untreated severe hyperthyroidism can be fatal.
So it definitely needs treatment. What about complications from the treatments? We touched on surgery risks.
Right. With surgery, the main specific risks are hypoparathyroidism, low calcium, hypothyroidism, if too much thyroid tissue is removed or damaged, and laryngeal paralysis.
And hypothyroidism, low thyroid function, can happen with the other treatments too.
It can, yes. It's actually a potential outcome after radioiodine therapy. Sometimes the treatment works a bit too well, and it can happen if the dose of methimazole is too high.
Is hypothyroidism a problem?
It can be. Interestingly, there's a growing evidence suggesting that iatrogenic hypothyroidism, meaning low thyroid caused by treatment, might be linked with a faster decline in kidney function and possibly shorter survival times in some cats. So we try to avoid making them too hypothyroid. The goal is usually low normal P4 levels.
That's a delicate balance then.
It really is.
So considering all this, what's the overall outlook? What's next? The prognosis for cats with hyperthyroidism?
Generally for cats with uncomplicated hyperthyroidism, meaning no other major health issues like severe kidney disease already present, the prognosis is actually quite good with treatment.
That's good news.
It is. Now, recurrence is possible, as we said. With methimazole, it might happen if owners struggle with giving the medication consistently. With surgery or radioiodine, sometimes a small amount of abnormal tissue might regrow over time, but it's less common if the initial treatment was successful.
Are there numbers on survival times?
There are some reported averages, but you have to take them with a grain of salt as they vary between studies. One often cited study showed a median survival time of around 4 years for cats treated with radioiodine.
4 years.
And around 2 years for cats managed medically with methimazole alone.
Only 2 years for methimazole. Why the difference?
It might reflect that radioiodine is often curative, while methimazole just manages the condition. Also, cats treated with radioiodine might be healthier overall to begin with. Interestingly, that same study found cats that received both treatments at different times actually had the longest reported median survival over 5 years.
Wow, 5.3 years, I think the source said. Interesting.
Yeah, it suggests maybe using different approaches over time can be beneficial for longevity in some cases.
But the prognosis changes if they already have kidney disease.
Yes, significantly. Cats with pre-existing significant kidney disease, when they're diagnosed with hyperthyroidism, generally have a poorer, more guarded prognosis. Renal failure, unfortunately, remains a common reason why hyperthyroid cats eventually pass away or are euthanized.
That kidney link is just so critical.
It really is. And just to circle back to the rare cases of thyroid carcinoma in cats or dogs, the prognosis there is generally poor to guarded. Even with aggressive treatment, the cancer often recurs.
Okay, so let's try to wrap this up. What are the absolute key takeaways for our listeners from this deep dive?
I think the main points are hyperthyroidism is super common in older cats. It's caused by an overactive thyroid, usually due to benign nodules.
Right.
It causes a whole range of signs related to that high metabolism weight loss, with increased appetite being classic. Diagnosis involves blood tests, especially total T4, and often other checks like blood pressure and assessing kidney function.
And there are good treatment options.
Yes, there are effective treatments. Methimazole, radioiodine, surgery, each with pros, cons, and monitoring needs that you really need to discuss thoroughly with your vet.
So the most important message for cat owners listening.
I'd say be observant. Recognize those potential early signs in your older cat. Don't just chalk up weight loss or behavior changes to old age.
Get it checked out.
Exactly. Work closely with your vet. Early diagnosis and finding the right treatment plan for your specific cat and their circumstances makes a huge difference to their quality of life and how long they can thrive.
Excellent summary. And finally, something for everyone to ponder. We know feline hyperthyroidism diagnosis seems to be increasing, and we've touched on these potential, though unproven, links to environmental factors like diet or chemicals. What further research is really needed? What are the next steps to truly understand why this is happening so often and maybe find ways to prevent it in the first place for our cats? Something to think about. Thanks for joining us for this deep dive.